So your predominant leadership style affects how you interact with others and team functioning in general. Leadership can also have a profound impact on workplace culture, and culture has a profound impact on how people work together. Now we will turn our focus to how leaders can facilitate a culture that supports effective collaboration. Status and power differences are well established in healthcare and give rise to poor communication patterns that can harm patients. We highlight psychological safety and leader inclusiveness because they help to minimize these status and power differences both within and between professions. We also highlight them because students and trainees, particularly those early in their training for whom these modules are intended, are traditionally viewed as having a perceived lower status and least amount of power on the team. And as mentioned earlier, these concepts help to facilitate mutual trust and respect, which is critical for effective collaboration. So to begin with, let's define psychological safety. It's a fear of being perceived as incompetent or embarrassed publicly, or some risk or threat, a sense of risk or threat of some kind that impacts people's willingness to speak up. I often hear from students that they did not speak up or ask questions because they were afraid of appearing incompetent. So psychological safety is a key ingredient in creating a collaborative culture. In psychologically safe environments, people believe that if they ask for help, make mistakes, or speak up, others will not penalize or think less of them. They can do those things without fear of negative consequences. And the literature shows psychological safety is affected by professional status. Individuals with higher status experience greater psychological safety. In other words, your perceived status may influence your beliefs about how easy it is to speak up or offer ideas, discuss concerns, or ask questions. Research has shown the importance of psychological safety in creating an environment in which team members, especially lower status team members, will feel comfortable speaking up. So why is it important? It facilitates learning and innovation because members have the freedom to ask questions and really think outside the box without worrying about the response. This is particularly important for students and trainees and for team learning in general. It fosters the confidence to take personal risks necessary for effective teamwork. And it's important for patient safety because people feel free to raise concerns as needed. So how might leaders achieve this? A leader can ask for questions, concerns, contributions, and clarifications by soliciting feedback on your own performance and really listening well to the responses. Leaders should give an explicit invitation that everyone should feel free to speak up, and this leads to a key strategy called leader inclusiveness. So Nemhard and Edmondson define leader inclusiveness as words and deeds by a leader that indicate an invitation and appreciation for others' contributions. It is actively engaging all members of the team, especially those who otherwise might not be heard. But it's not just engaging all members, but what you do with their input. If team members don't feel that their input is valued or used appropriately, they may be less willing to engage. Leader inclusiveness is a strategy for facilitating a collaborative culture because it promotes psychological safety. The more one actively engages all members of the team, the more members feel safe in speaking up. Leader inclusiveness can also minimize the effect of status on psychological safety. So when leaders show inclusiveness, lower status individuals are likely to gain the most in terms of increased safety. Leader inclusiveness also helps to establish trust and respect. It leverages diverse knowledge, experience, and expertise. It promotes shared responsibility and accountability. And it promotes engagement in quality improvement work along with psychological safety. So how might a leader accomplish these things? One, by setting the tone. That could include introductions, which include the role and abilities of each member, as well as welcoming new members. Sharing information and rationale. And asking questions, but not just any questions, a right type of question. As an example, asking, "Can anyone help me?" not only elicits help, but also shows humility and openness to feedback. Along those lines, soliciting input and recommendations. and making decisions based on the input of others. So in summary, psychological safety and leader inclusiveness are two components essential for a collaborative culture, and I would argue that the leader is responsible for psychological safety and creating the space to make that happen. There are practical ways leaders can apply these concepts in any setting, and examples include inviting questions, clarifications, and concerns, soliciting input from all members, and making decisions based on integrating the above. So for this segment's forum discussion question, can you think of a time when you did not feel comfortable asking a question or voicing a concern? And why did you feel this way? Could the words or actions of others have changed this, and if so, how?